So there's now news, including Senator Nelson is saying we need to stop international travel, et cetera. Would you mind opining on that, Doctor?
So the CDC and the government has decided that as of this weekend, there'll be 5 airports in the United States that will have extra screening. I don't know what that means. Obviously, people who are coming from Western Africa, but you can't come directly from Western Africa here. So how do you know where they came from? They got, the airports are JFK, Newark, Atlanta, Chicago, and Dallas and Washington. I mean, I think that's foolish. I think basically you have to have the medical community aware of what an Ebola patient will look like. And when you have one, like in Texas, you quarantine everybody who's had exposure. And that's how it will stop. I think stopping travel to countries gives you a false sense of security. I don't think it will work.
Thank you.
Yes. Yes.
We just had our first tabletop drill at Bethesda Hospital. It took a lot of pushing. It was a little more than a tabletop. There were about 60 people there. And I'd be willing to take any questions and stuff on CERMO. If you haven't joined CERMO and you're a physician, you should join. It has an infectious disease hub and it has people that have been involved in these outbreaks. So we've been very lucky at Bethesda to have a food-trained physician come by. And it's going to take 2 or 3 sessions before we get all these protocols put into what would work for our particular hospital.
Well, I think the major thing is that if you see somebody who has any febrile illness and you ask them, have you traveled? And they tell you where they've been, and that gives them a potential exposure. The ER people ask me this all the time, what do we do? I said, you put them in full isolation and you call the health department. That's what you do. Don't even draw their blood because it's not going to go to your lab. Why expose? Yes?
Quick question. There's an epidemiologist from Tufts University that says from the food fats in the jungle, that's where it starts, as you mentioned. But he says that the current outbreak, I think he hinted it, actually started within the cities. Is that right or wrong?
No, it did start within the cities, but somebody had to come into the city and actually bring it from there. And they can get it from primates, from butchering, other things.
They call it bushmeat, and it's actually brought here to the United States secretly sometimes.
But we've never had a case.
Never had a
Yeah, and we've never had a case brought that way here. Yes?
Is it known how long the virus survives on environmental surfaces?
I'd say it's probably somewhere like hepatitis B and put it in the range of maybe 4, 5, 6 hours. You know, the concern always is, and what the CDC and what a lot of people are saying is don't be fearful, it's not spread respiratory-wise. And there was a great article in the New York Times a few weeks ago by Michael Osterholm. He was a fascinating guy. I met him during the anthrax thing. And he works for the government and the University of Minnesota. And he basically said, you're right, it's not airborne, but it could become airborne, is what he said. And that's not to make anybody fearful. It's to take away the idea that this can't happen. Of course it can happen. Hopefully it won't happen. Thank you.
Since Dr. Bush agreed only a few days ago to do this, this is still warm, so be careful. Thank you very much. Well, we've now come to that part in the day when many people have jokingly said this is the high point of the program. But I'd like to ask Dr. Asquith to come and introduce the moderator for the panel, Brent Schillinger.